Mental illness is defined as a behavioral or mental pattern that causes significant distress or impairment of personal functioning. Throughout history, mental illness has generally been looked down upon. While mental illness has been recognized all the way back to the Greeks, it wasn't until 1883 when Emil Kraepelin published his first book stating some mental illness diagnoses, as well as suggesting there might be some underlying psychological cause. There have been many attempts to treat mental illness from good to bad. Significant strides have been made throughout the decades, evolving the process from treatments like insane asylums to the introduction of ECTs to the hundreds of options that we see offered today.
The idea of insane asylums was brought over by the European idea that mentally ill people can be treated and recover from their illnesses, but although recovery was a priority, it didn't often seem that way. The first asylum built was the Public Hospital for Persons of Insane and Disordered Minds in Williamsburg, Virginia, founded in 1768. One example of the sick past of insane asylums is the Bull Street Asylum in South Carolina. It opened its doors in 1828 but began struggling with funding soon after, so the quality of treatment diminished and the size available for patients shrunk. Accounts of abuse, forced sterilization, and other cruel types of treatment such as lobotomies, which are thankfully now illegal, have made this asylum very notable. In other parts of the U.S., where asylums were not available, anyone deemed too mentally ill would be kept in a jail or an almshouse, which is like a homeless shelter. Later in the 1800s, the unsteady improvement of mental health treatment began. Moral treatment was a system developed in the late 18th century by Benjamin Rush in the United States. It was the idea that if patients in mental asylums were treated kindly and were appealed to through parts of their brain that remained rational, their mental illness could be cured. It hindered on asylums being a quiet and peaceful place meant for healing. However, as the 19th century progressed and new treatments emerged, conditions in mental asylums got much worse. Barbara Floyd from the University of Toledo said, by the 1880s, asylum conditions had deteriorated significantly, and neurologists began to vie for control of institutions. They opposed superintendents and questioned the validity of the asylum itself, promoting the clinic instead. In 1880, they formed the National Association of the Insane and Prevention of Insanity.
In the long past, there were several inhumane treatments imposed upon patients. Things such as metrosol therapy, which is the practice of using medication to induce seizures, was very ineffective in treating schizophrenia and often resulted in fractured bones and torn muscles. Also, lobotomies were a severe form of treatment where parts of the frontal lobe or prefrontal cortex were surgically removed from the rest of the patient's brain. This treatment had occasional successes, but more often than not resulted in other impairments. Our last example of inhumane treatment is ECT, or electroconvulsive therapy. ECT began being used in the mid-1900s as a way to treat severe mental disorders. When it was first invented, practitioners did not use safe practices and oftentimes caused harm to the patients. However, when delivered safely, ECT has proven to be beneficial for many of the patients who underwent it. It is often portrayed as a punishment or a looming threat to patients in mental hospitals. Today's ECT, called modified ECT, is much more safe and has little to no proven side effects. Through the 1800s and 1900s, conditions were thoroughly improved in mental hospitals. Many people dedicated their lives to the improvement of conditions, such as Dorothy Dix, a revolutionary who decided to reform the way that mentally ill people were treated when she saw convicts being treated horribly. Dorothy Dix played an instrumental role in the founding or expansion of more than 30 hospitals for the treatment of the mentally ill. She is most famous in NC for forming the Dorothy Dix Hospital in Raleigh, which closed its doors in 2012 after over a century of service. At the same time, revolutionaries also improved scientific practices of treatment with medicines, an example being Thorazine, the first psychotropic drug, which was introduced in the 1950s and was highly successful at calming anxious and unruly patients.
When it comes to psychological treatments in modern-day times, there are numerous options for individuals suffering from issues to choose from to best fit their needs. These options they can choose loosely fit into two categories, inpatient therapy and outpatient therapy. First, we're going to look at the more common approach, which is outpatient therapy. Outpatient therapy usually is diagnosed or used by those with mild to moderate symptoms or a solid support group, or most importantly, the ability to function normally in everyday society. There are many options to choose from one-on-one treatment to group therapy to family therapy, support groups, and many more. They can be online or in person depending on what an individual wants. First, we have an interview from Lucy to describe her experiences with outpatient therapy.
I get outpatient therapy and see a psychiatrist. I've been seeing my therapist for about 5 years. When my depression got really bad in 8th grade, I would see her once a week or once every 2 weeks. As I've improved with her help and the medication I get from my psychiatrist, I've started only seeing my therapist as needed. Talking to my therapist and having her give me ways to get through the dark times have helped me immeasurably. She gave me strategies to cope with my anxiety and depression and supported me when I felt like I would never recover.
Now to focus a little more on inpatient therapy. While individuals can choose this option, it's also common for people to be required to enter psychiatric institutions to prevent them from causing harm to themselves or others. These institutions are usually watched to make sure all is fine and set up to protect its individuals who are staying there. There are also multiple types of treatment options offered there as well to help the individual recover and leave the institution. And next is Stasia with her experience in inpatient institutions.
From my experience with inpatient psychiatric treatment at the UNC Chapel Hill's Adolescent Psychiatric Ward, I'd say it was a pretty nice place. I felt pretty isolated, but at least safe. I was on a number of medications, and the nurses varied my doses to assess what worked best for me. All patients there were obligated to participate in group therapy, where we congregated and discussed our feelings, recreational therapy, where we had fun to feel better, occupational therapy, where we did day-to-day activities to distract ourselves, and art and music therapy, which is exactly like it sounds, and it was my favorite. My treatment didn't feel specific to my problems, but it worked well enough.